All right, today on Ask Dr. Lori, the difference between food intolerances and food allergies. And Dr. Lori, in layman terms, what is a food allergy?
Well, a food allergy and a food intolerance are definitely two different things. So, a food allergy actually is one of those reactions that people have to food that is an immediate immune related response. So, this is something that we think about kids who have peanut allergies or an adult that has a shellfish allergy. This is something that's going to cause you to have a chemical reaction that happens immediately after consuming a food, and it's very dangerous. So this is the ones that we associate with anaphylactic reactions, your throat closes off, hives, serious hives, and rashes that will put you in an emergency room. These are people, food allergies, where the people require an EpiPen so that they can recover from these issues that they have from eating the foods that they're allergic to. And also, the testing is considerably different for people who have food allergies. So, food allergies is something that doctors can typically find if they do just what they call a scratch test in their office, or even do a certain blood test through a traditional doctor. And that'll find, these foods that are high on the list of things that patients are allergic to. But it's considerably different from a food intolerance.
For example, the food allergies, I've heard people do this. They'll go to a physician, someone who's certified, and they'll get like little pricks in their arms, and then based on the reaction of that, they'll know what their allergies are.
Exactly. And the thing about those tests, they're really good for finding out if somebody's got a food allergy, a full-blown anaphylactic type of allergy that a patient would have. But I've also had the scratch test done on me several times when I was little and growing up. And they would scratch you 100 times on your back or on your arm, and they would go through and do the testing, and they'd say, oh, well, you're not reacting to any of these foods, because they'll test you for 100 foods on that test. There's a problem with that, though. That is not a very good specific test to find food allergies. It's great for environmental allergies. It'll find your environmental allergens like molds and dust and mites, but it is really, really not specific enough to show you specific foods. So that's how we get into the food intolerance.
This is bringing up the topic, and I don't know this, and that's why I'm so glad we're talking about it. People talk about I'm allergic to gluten. Is the intolerance along that lines, or is that an allergy issue?
So that's where the terminology, we get it wrong. So they're saying I'm allergic to. So, and actually, unless they're celiac, that have a full-blown celiac is the disease that actually where you are allergic to gluten and your body attacks itself. It's an autoimmune condition. That is a true gluten allergy. But for the most part, people are intolerant, meaning that they're going to have different symptomologies. So when you see an intolerance in a patient, and that's something that I do testing for, and it's an IgG mediated blood test. So it's not a scratch test, it's a blood test. And so when we perform this blood test, we send it to a lab and they start growing out the samples, and they'll look for up to 300 different foods and try to look at what exactly are causing the quote unquote intolerances. An intolerance is actually something that happens not immediately, and it's not an immediate immune related reaction. So this is something that people could see a few hours later. But typically, in most of my clients and even in myself, you will see it 2, 3, and 4 days after you've consumed the food, which I find is extremely interesting. So when we start looking historically with somebody with a food intolerance, I can say, like, one of my clients had a reaction to something weird, didn't know, called me and said, I'm having a migraine headache. And it's really bad and I had to miss work today, but I can't pinpoint it. Well, I had her food intolerance list of things that she's intolerant to. And I said, so what did you eat 3 days ago that might be different? And so there was something on that list that she had eaten that she had never had before, and ended up that was the food that caused the migraine. So that's one of the symptoms that a patient's going to have. So migraines, you can have sinus congestion. You can get the hives and you can get rashes, but it's typically something that'll show up like 3 or 4 days later. You can get acne. So a lot of women are suffering from severe cystic acne, especially later on in life. That's one of the intolerances that you'll see is, say, maybe you have dairy and 3 days later you're going to end up with a whole bunch of big pimples that you didn't have before. That's something that's a food intolerance. It's not going to close off your throat, but it's going to be something annoying. Drippy nose, again, sinus congestion. Some people get congested in their ears. Joint pain. Joint pain is another one that a lot of people get. Puffiness, constipation or diarrhea can go back and forth. The inability to lose weight. So a lot of people start gaining weight because of their food intolerances because they keep eating foods that are the most offensive to their body. And that's even the weirder thing is people who have food intolerances, They typically crave the foods they're most allergic to.
I
Have you
have
heard
a,
that one?
I have, and I have a friend who had some issues with gluten, sugar, as well as eggs, and she has to be real careful when she goes out to eat in a restaurant that I cannot have this. I have to make sure there's no sugar in this type of solution. It can be really constricting on your lifestyle, and she kind of after years of just being lethargic and not having the energy level that she used to says, I need to get something to take a look at. And now she had to revamp her whole lifestyle, and it's all based on the foods that she eats.
And it is. And here's something very interesting too that I get asked all the time. Is this permanent?
Oh.
So if I have these allergies or these intolerances to food, is this permanent? And the cool thing is no, it's not permanent. So what we can do when we have patients who have these intolerances is we do a complete elimination. So I'll have them eliminate these foods for 6 months and to have them be very, very strict with their diet, know exactly what they can and can't eat. And then after 6 months, we can try a reintroduction one thing at a time to see how they react. But the key to food intolerance is never eat the same food two times in a row, 3 times in a row. Never eat the same food 2 days in a row. So you need to rotate your foods appropriately so that it's not causing that insult. Because when you have an intolerance, it's typically caused from something we call leaky gut. So food is actually getting into your blood system where it's not supposed to be. Your gut barrier is supposed to protect that. And so when food gets in there, you have an immediate response to where you're starting to form antibodies against it. And that, like, again, can take 3, 4, 5 days for that to happen. And now the next time you eat that food, you start having this reaction and go, what is going on? So if we fix the gut, repair the gut, take the foods away, reintroduce them slowly, we can have a situation where we can start having those foods again. Now, I've been doing this for 5 years on myself, and I still cannot have dairy. Dairy is still one of those things for me that is just completely offensive. And for most women, actually, that's one of the main ones. Dairy, soy, sugar, like refined sugar products are the biggest ones on the list. Gluten definitely is one of the biggest ones on the list as well. But these are, again, not full-blown allergies, but doctors can't find it on tests. And therefore you say, well, you don't have this allergy. But if you come to a functional medicine practitioner like myself and we do the blood test, you don't have an allergy, you have an intolerance. And yes, it's very real. The symptomology is very real. And we can find very real ways to actually deal with these situations for people and make them feel better. I've had a couple clients that had massive weight losses right after eliminating those foods.
We have time for probably one more question. I hope this isn't too much. Maybe we'll just have to get to the surface of this. But how would these things affect someone who's a lot more active or like an athletic performance in their beyond what they do 9 to 5?
Oh, see, that's the cool thing too. So this particular blood test that I run on my clients also is being used by several athletic teams, even NFL players. And elite athletes, even triathletes, would use something like this because in performance, if you're having these symptoms after you eat and it's supposed to be a food that's helping you so that you can perform better, say carb loading or whatever you're doing pre-race, and a lot of times you're doing goo. It's like the goo with the sugar and the stuff in it. Mm-hmm. Okay, well, if you're allergic to sugar and you're having a problem with refined sugar, that does have refined sugar in it. And that's going to create a problem for some people to where they're supposed to get energetic from it, but in actuality, they're actually getting more fatigued from it. It's hindering their athletic performance severely. So now these professional athletic teams are jumping on board, having their functional medicine practitioners perform this test on them so that they can see if there's any foods that are in these athletes' diets that are going to cause them to not perform at the peak level they should. Because if you're tired, if you get diarrhea, or if you get constipated from eating something, that in itself, you're having digestive issues, that's going to contribute to you not having a good performance with your athletics. So this is a really cool thing to start using in athletes. And I've got a few of my clients now that are into professional bodybuilding that were kind of looking at this as an alternative of really to get them to their next level.
Clearly, you're helping a lot of people with the tests that you perform. Does someone have to be in the same city as you to have you conduct this test for them?
No, see, that's the other cool thing. So the way that I've worked a lot of my tests, this is one that's very similar, is I can do this test from anywhere across the United States because the way it works is I send out a phlebotomist to your home and they do the blood draw in your home, and that can be anywhere in the United States. And so anybody can have this test run on them. We can figure out your results you'll have back in 10 to 14 days, and we'll know exactly which foods you can and cannot eat. And within a lot of people, within 3 to 4 days of starting the elimination of knowing exactly what they're allergic to or actually intolerant to, they start feeling better immediately. And again, it could be as I had one client who lost 6.5 pounds in 2 weeks just by eliminating the foods that were offending to her.
Wow. Your website so they can contact you.
Okay, they can contact me on healyourselfbeautiful.com. Just send me an inquiry, and we can get you set up with a consultation or just ask any questions that you want about the program.
And if you have a question you want to ask Dr. Lori on a future video like this, use the hashtag AskDrLori, Twitter, Facebook, or YouTube, and we'll do our best to get it on video for you. Thank you, Dr. Lori.
Thank you.